What is a blood clot? A blood clot is fine more what it screeches like, a lump of blood. However, it's when the composition of the blood changes from liquid to a more gel-like state. Further, what happens when you obtain a cut? You bleed for it a little, but it sometimes stops because the blood coagulates into a more solid state, which ends the blood flow. But there are times when blood clots are more cautious, like when one sets inside of your major veins. This is convened as deep vein thrombosis, DVT. If the blood clot remains where it is in your physique, it's usually not dangerous, but if left untreated, it can go across through your veins to your heart and lungs. A blood clot in the lungs is known as pulmonary embolism, P. This can be harmful and needs medical attention. More than 900,000 Americans in a year are concerned by DVT with PE, as per the Centers for Disease Control and Prevention, CDC. Approximately 100,000 Americans expire from these kinds of blood clots each year. While the symptoms of a blood clot depend on the kind of blood clot you're suffering, it's essential to be able to identify the warning signs of blood clots before they get worse. 1. Racing heart. A blood clot in your lungs may be hampering the flow of oxygen in your lungs, and a quick heart rate may arise. In understandable terms, the heart is striving to reimburse for the shortage and may start beating rapidly. 2. Chest pain. Several people keeping a pulmonary embolism think it's a heart attack because the distress is similar. The warning sign could be a blood clot if the discomfort is sharp or stabbing, and airs worse while taking a deep breath. The pain might get in a worse situation with every breath you inhale. 3. Shortness of breath. A blood clot in your lung might bring difficulties to inhale due to the slow oxygen flow. You might unexpectedly feel faint, like you're around to lose consciousness. 4. Unexplained cough. People usually liken a cough along with a cold or strep throat. Still, if you are suffering from a dry cough with no possible explanation that appears to have come out of nowhere, it could be the indication of a pulmonary embolism. If you cough up mucus or blood, immediately call for medical help. 5. Skin discoloration. If you are suffering from deep vein thrombosis, it may result in a patch or stake of redness on your arm or leg. It might also sense warm and tender when you touch it. 6. Sudden swelling. If you see one ankle or shin unexpectedly come to be swollen, this could indicate deep vein thrombosis. This might occur if blood flow in the legs is being obstructed, resulting in blood pooling behind the clot and puff up. 7. Arm or leg pain. This might hardly sense like muscle cramping, but pay attention if the pain is awful when you are stepping or turning your foot upward. The skin around the injury may be ruddy, swollen, or warm as well. 8. Vomiting. If you retain mesenteric ischemia, a fancy way of telling a blood clot in your abdomen, it could affect you to become nauseous and heave. This usually goes along with awful pain in the abdomen area. 9. Impaired vision. Can't notice well out of one of your eyes. It could be a clue of central retinal artery occlusion, particularly if vision loss is associated with vertigo and balance problems. Risk factors for blood clots. Various risk factors lay someone at a higher chance for a blood clot. You're pregnant, you're fat, you smoke, you have diabetes, you're over the age of 60, you're static for a long time, you had orthopedic surgery, you're touring for a long time in an aircraft, car, or train, and you're not eligible to move around much. You have unavoidable blood disorders that compel you more likely to clot. You have cancer. Blood clot prevention. There are some preventive measures you can do to lower your risk for blood clots. 1. Learn your risk. It would help if you talk to your doctor about your chance for blood clots. Suppose you are at an increased risk and practically concerned to do something that will lower the chances of a blood clot forming. 2. Strive for overall healthy habits. You should stay physically healthy and don't smoke. The high risk of blood clots is yet another intention to stop the smoking habit. 3. Talk with your healthcare providers. It would be best to talk with your healthcare providers to get back on your feet shortly after surgery. Try to maintain any health conditions like diabetes or high blood pressure under control.